or injury, and they'll live their best life.
Find out more when you visit us at Active Health Clinics, Fort Dodge.
Michael Devine, the Doctor of Truth.
Does anyone have anything they'd like to confess?
That AM 1400 KVFD.
That's right. I'm Michael Devine, the Doctor of Truth, and we're going to keep pumping the truth at you until we all choke on it, I guess. Joining, I thought Carrie Underwood was coming today, but no, it's Kerrie Prescott. Maybe that's better. I don't know. Can you sing?
Yes, I can.
Can you? What sort of? Can you sing any Carrie Underwood or not?
Oh, probably not. I wouldn't do it justice.
Now, don't tell me all you know is hymns. I don't want to hear Amazing Grace in the middle of the afternoon. Okay. All right. Okay. Well, Kerrie Prescott is director of Webster County Public Health, and they were a group that was invaluable to me when I was so sick with COVID. And I'm happy to report, Kerrie, and to the listening audience once again that I'm recovered. And I have about 95% of my strength back. Of course, when you sit in a chair for 6 weeks, it's amazing how fast your muscle tone disappears. And I didn't have that much to start with, But thank you and everyone over at I had a public health nurse check on me every week. And I had, I don't know if public health arranged this, but I had a physical therapist come and work with me. And I needed all those things. Well, most important, public health got me some food.
Yeah.
Now, it's not that I couldn't pay for my own food. It's just that I couldn't get to the grocery store. I couldn't drive. I couldn't walk. I couldn't do anything. So the people at Public Health, and I'm very, very grateful to them, brought me over some food. I don't think you ever charged me for it. So that was terrific. Yeah. Good food, too.
Good deal.
Good food. So you've been, I suppose, COVID in Webster County has been keeping you pretty busy over there.
Yes, it has. For the last couple months when we've, started seeing more cases, our staff is pretty in tune to a process now. So I think our highest counts were in November, the beginning of November.
No kidding.
Yep. And then we're kind of seeing less of positives being reported to our office on a daily schedule, but we're not naive in thinking that it's in any way flatlining. So we're just kind of waiting for the holidays to get through. We're a little anxious to see what happens next week with our positivity rate, to see if people were gathering and things like that. So I try not to speculate. We're just prepared to handle whatever comes through our doors next week. So.
What is the role of Webster County Public Health in this COVID pandemic?
Yep. So our primary role and responsibility is to, when the providers in our community identify a positive, then they are to submit that test to the Iowa Department of Public Health. And then we have a database where we pull all the names off of the database, and then we call everybody, and we're primarily responsible for making sure people are in isolation. We check on them to make sure that they aren't an independent person living by themselves, and make sure they've got the resources. If they're supposed to be isolated and not go anywhere for 10 days, what do they need? Do they need food like we offer to you? What else? Do they have a support system? We put them in isolation, and then we contact the close contacts of those positive cases, and just identify them and let them know that they've been exposed to a positive COVID, and then to watch for signs and symptoms. And we do that pretty much all day.
You've been exposed many times, I'm sure.
Yep. Yep.
Have you had COVID?
I have not.
Has any of your staff?
Yep, our staff. There's a few in our staff that have. Yep, and we follow the policies and protocols, obviously. We're very strict about not working when you're sick. And so, lots of people have different varying symptoms. So, if people have a allergy type symptom or feel stuffy or whatever, we highly encourage people to not come to work. So we've tried to contain it. And so far, as the majority of our staff have not come down with the COVID, with the virus. So,
well, that's the good news then.
Yeah.
The doctors in the hospital again told me they didn't know what was going on with COVID. They don't have any idea how to stop it necessarily. They have an idea, of course, how to prevent the spread. We can do. By the way, I'm an advocate for masking. Mm-hmm. I was not so turned on about it before I had COVID, but nothing like spending a week in the hospital and 6 weeks in a chair,
right,
to turn your head around, and it certainly did for me.
Right.
So, but they we still don't know what the deal is.
Yeah. And, the big thing too is, the masking is very important, but there's other mitigation pieces too. Keeping 6 feet away from somebody that you're not sure of what their patterns are, who they hang around with, limiting your contacts, limiting your gatherings to, 8 or less.
Mm-hmm.
Those are all mitigation. Wash your hands. And, there's a lot of mitigation efforts that we, if you're in tune to trying to protect yourself, I mean, there are mechanisms in place that you're able to. And sometimes it's just bad luck, I think,
Yeah. Yeah. I went out to Spokane, and the state of Washington has these some of the strictest masking and COVID prevention regulations in the whole country at that time. They're probably even more stringent now.
Mm-hmm.
And I still got COVID, And a friend of mine who went out with me got COVID as well. But the funny thing with him, it was over in a week. With me, it went on and on and on.
Yeah.
So I don't know how I got so lucky.
Yeah. Yeah.
But the nurses also told me at that time that the people kept coming. The people kept coming to the hospital with COVID complaints.
Oh, wow.
And
because you were in when?
First week in November.
First week in November. Okay. Well, and that would probably coincide because I think our numbers were the highest around the 13, 14, 15. I think we had a record amount of positive cases above, was like 150 in one day.
That's pretty good for a county our size.
Yeah. Well, but that's, one day from, the previous 2 days. And so, we kind of stayed at that for a while, and it was really very concerning. I mean, I think we were up in the 25% of positivity. And so now I think we're down in the 13% positivity, and we averaged I think our lowest day was 15 last week. And then we get like 30s someday, 35. I don't think we've been over 50. I think it was before Christmas when we were above 50. So, I watch those numbers every day just to kind of see what's happening. There's a lot of variables to those numbers. Are people being tested? Are they just assuming they have it and not being tested?
Yeah.
And so there, the data is only as good as what's reported through our system. So, I mean, there's a lot of variables. So to arbitrarily say, yes, we are at 13%, it's a statistic that we can follow, but
Yeah.
I don't know how truthful it is.
Right. Have you been in contact with the hospital? I mean, are there still beds out there if they need them, or?
Yep. So we get it's called an RMCC report every day to let us know when hospitals are in red, yellow, or green status. And I review that report every day. And then we're in constant contact with the hospital. Like for instance, when we can't, so we do the 10-day, release of isolation. So once somebody has COVID, we put them on a 10-day isolation, and we call people positive cases on day 9 or day 10 and say, how you doing? We're going to release you. If you're symptom-free, fever-free for the last 24 hours, you can resume normal activities. And then we give them a date. So when we make telephone calls and we can't locate somebody, we'll call the hospital and say, okay, we can't locate. Do you have this person with you? Because then if they say no, then we kind of get a little bit more concerned, and then we'll go and check on people to make sure that they're not in their home, sick or, not able to answer the phones and things like that. So we try to make sure that we go a little bit another step farther to make sure that we care for the people that are positive. So
how long have you been over the Department of Public Health?
Long time. I think I'm on my 23rd year.
23 years.
I know.
Wow.
I started when I was 13 though.
Yeah. Me too.
Yeah. I've seen a lot in 23 years, I tell you.
I bet you have.
Yeah. Yeah. It's a wonderful job though. So
this has to be one of your biggest challenges over at Public Health.
It really is. A lot of times we're in the feel good, providing services to, people that are in need. Our maternal child health program helps new moms. I mean, it's that kind of feel good services.
Sure.
And, lately it's not always feel good. People are angry if we're putting their kids in isolation, or, they don't agree with the vaccine, or, they don't agree that they need to be quarantined because they've been in exposure, and, or they have to be off work, or they can't can't go to some youth event or can't go to a funeral or something. And so sometimes we're the bearer of bad news. So yeah, the last couple of months have been a little bit more challenging for our staff, but overall they're managing. So
They're managing. Well, that's a good thing to hear.
yeah.
What about the vaccine? When are we going to see the vaccine in Webster County?
Yep. So the end of December, we received our first shipment. So we work very closely with the hospital. It's in that, I'm sure everybody's been hearing about that 1A phase, direct healthcare workers. And then there's a threshold of exposure. So we've been working closely with our hospital. They've been vaccinating people within the hospital system that have direct exposure to COVID patients. And then we have been taking care of the public. So the community, anybody that would be a community healthcare worker, we've been scheduling clinics and going to people to vaccinate them as well.
Okay.
So we just got, the hospitals received 2 shipments. So we received 1, and I'm hoping that we'll have another shipment being delivered to us within the next couple of weeks. But the vaccine we're in a vaccine shortage as well. And so yeah, we need to, be very good stewards of that vaccine right now.
I have no problem with healthcare workers and the police, fire being first in line. I don't. When do we get around to the old white guys?
So what we're waiting for, it's a great question. We get several calls a day wanting, from different people in the community asking when it's their time. Unfortunately, we have to follow what the Iowa Department of Public Health pushes down to us. What I've heard for the 1As, what the plan for the 1Bs is that they will give us a directive to say, it'll be either this group. I don't want to name groups because I don't want anybody to get a false sense that they're going to be in these groups that I name, but they will tell us it might be the elderly. It might be school people, school workers. They will be very definitive because we're in a shortage. And so then we have the challenge of then being the distributor of that vaccine and validating that they actually fit into the categories that we're supposed to be vaccinating. So, the most vulnerable population is our elderly. So I would hope that they would come back and say, this next round really needs to go to our elderly out in the community. Our long-term cares are being provided with pharmacy contracts. So the federal government and the state contract with CVS and Walgreens in Webster County, and then their staff go and vaccinate the skilled nursing facilities and the campuses. So that's one less duty that we have to do. And so a lot of our vulnerable population is starting to be vaccinated here in the month of January. When we get our next dose, I'm hoping that we will give the directive that we can take care of maybe 75 and older, or, depending on how many shots we get, 65 and older, I don't know, but I've just got to wait for that guidance. And then, we sign a contract that will follow the guidance. So once we know the guidance, we will definitely push it out to our community because we want to get it in arms as soon as possible.
Well, I hate to put myself in the category of elder person, but I guess here I am. So what is the deal with people who've already had COVID? I mean, are we priority or bottom of the list or? Yep.
So you fall within whatever priority you are. So if I say 65 and older, if you fit that category, you still are qualified for the vaccine. Our recommendation is that if you're in quarantine because a close contact, or if you are currently positive, we need you to serve those either isolation guidelines or quarantine guidelines before we would want to vaccinate you. So when we have a pretty good sense of who's in quarantine and the family units and things like that, so we can kind of help with that guidance. But yeah, if you're is household contact with somebody that's positive, we would wait to give you until you've served that quarantine time frame.
Yeah.
So
well, that's all good. I mean, are there any results concerning the effectiveness of the vaccine that you're aware of?
Yeah, so I think that they were in the 94-95% efficacy. I'd have to pull out the data. And we're seeing a few slight side effects from people getting the vaccine, that they're showing some type of COVID symptoms, maybe have a headache or sore arm or some, just like the flu, you might get some of those type of symptoms after you get a shot like that. The vaccine is new. And so for me to say, yes, it's 100% effective. I have to go by what the science tells us. And right now they're telling us it's above 94, 95% effective. So,
well, there's nothing wrong with that. I mean,
yeah.
That's a pretty good rate. I don't know what it is for regular vaccines, but I'm assuming that that's pretty good.
Yeah, I think the flu, and I'm just kind of going by past I think the flu is around 70% effective. And so, like the flu, the flu doesn't guarantee you're not going to get the flu. It just lessens your symptoms if you get the flu. And
right.
So, yeah, I mean, I would highly, highly recommend it. I know when it's my turn, I'll definitely be in line to get it.
I was offered a flu shot the other day, and because I already had COVID, I turned it down. But I think I'm going to go back and get it. And I have one more shot for pneumonia.
Oh, yeah.
They've given them to me. The first one was in 2016, I think.
So you need your booster. Yep.
Yeah, and now they're going to give me the last one. And I was offered that the other day, and I kind of backed away from that too. But I think I'm okay now as far as COVID fears. So I'm going to go ahead and get those shots.
Yeah, and there's other stuff going around right now other than COVID, and we do have flu going around. We do have pneumonia. There's more things, and so we don't want to just assume that you have COVID. We do want you to get to a provider and be checked out and be screened for whatever is making you sick. So, and be aware of what's going on.
Sure.
So,
well, it's been quite a year, hasn't it?
Yes, it has.
But we're in 2021 now.
Woo!
I don't like the way it's starting out in the nation's capital for 2021. I'll tell you that.
Isn't that incredible?
Yeah, a woman's been shot in the capital of our country, and police had to draw their weapons when protesters came crashing through glass doors. It's insane. Joe Biden, who was the wrong guy to demand this, but he has demanded that President Trump, condemn the rioters. Of course, Trump's not going to do that,
right?
Which is a disgrace in itself. But I don't want to drag you down that alley, so we're good. Kerrie Prescott's been our guest. Thank you, Kerrie.
Thank you.
This is AM 1400 KVFD.
A new year, new flexibility. Hello, I'm Megan Grebner, and this is Managing for Profit on Brownfield, a content partnership with the Roundup Ready Extended Crop System. Looking ahead to the 2021 planting season, farmers continue to look for ways to improve yields and better manage weeds. In this Managing for Profit, Megan McCoy, soybean traits marketing manager with Bayer, talks about the new opportunities for